Come on here and talk about a hot topic right now, especially in weight loss, and that is these GLP-1 inhibitor injections. So a lot of thought out there about the safety of these injections and should we be using them for weight loss or should we be using them at all? And so I wanted to give my thoughts and my approach to my patients that I typically do. And so for my diabetic patients, I consider the relative risk and for all my patients. And what I mean by that is that I compare the risk of not treating diabetes or not giving them this medication and the disease process worsening with diabetes and all the things that can happen with diabetes compared to the risk of taking these medications. And so diabetes, of course, is a horrible disease to have. And so the risk kind of compare, I'm going to be favorable towards these medications to use in those patients. So now my weight loss patients, I don't have that disease process to worry about other than I'm trying to prevent it. I'm trying to prevent further metabolic disease or like diabetes or metabolic syndrome, fatty liver, hypertension, heart disease. I want to prevent those diseases from happening as best I can. And so I do take that approach where I consider that risk. I consider the risk of the side effects from these medications. There's lots of opinions out there. There are starting to come up short-term studies on the safety of these, the benefits versus the risk, and the adverse effects. We have some case studies showing some pretty bad adverse effects like pancreatitis, even vision loss, worsening gastroparesis, which is a slowing down of the bowel movement in the body. So pretty serious side effects. I typically see more and heavier and side effects from the higher doses. And so obviously with my patients, I want to keep them at the lowest dose possible because I want to be the safest for my patients. And so that's typically my approach is I monitor the patient, we monitor your side effects, we monitor that dose, we try to keep that dose low. And so we use other therapies, we use other supplements, we use other things, supplements and therapies that we know help to further lower insulin as a hormone, as a fat growth hormone. And so that helps us to keep that dose low. So there's another thought out there that I've recently encountered, and it's called microdosing. And what this does is we're taking patients who may or may not need to lose weight, but they're showing signs of metabolic disease, whether it's hypertension, starting to have evidence of fatty liver, high cholesterol, have a family history of heart disease. So we want to do some preventive measures in these patients. And so can I microdose these medications, these GLP-1 inhibitors, and instead of putting them on a high blood pressure medicine, can I give them a tiny dose of this just to get that benefit of a lower blood pressure, to get that benefit of a further controlled cholesterol and lipid panel? And so I do like that thought with that because the risk and the side effects at these small, very low doses is very minimal compared to the side effects and the long-term safety data of multiple blood pressure medicines, statins, all the things that go along with treating metabolic and heart disease. So I do like that approach, and that's typically the approach that I do with all of my patients is I try to stay on the lowest dose possible because we are trying to be safe, safe for every patient. So we monitor you very closely. And so if you like to get help, if you like to talk to me, call us, come see me. We also do televisits as well as seeing you inside the clinic. If you have any questions or any comments, just let me know and we will be glad to get back with you and have that conversation. But you guys have a great day and I will see you soon. Bye-bye.